Hi, Dr. Kim Lara here. I'm here with Dr. Jose Lara, and today we want to talk to you about expectations you can have while undergoing chiropractic care.
That's right. Many of you ask, what should I be feeling like? How long will this take? Will I be feeling better or worse? What it may be. And it's different for everybody
It
because you
is.
might be coming in with a condition that's been there for a long time,
Mhm.
or it just started a week ago and you can hardly walk. So the expectations are different to where you are. Ultimately, the goal is to get you doing as good as your body will do in the shortest amount of time. But what I want you to understand is that it takes time. So it's kind of like imagine that if you were to fall and land on your arm and your elbow breaks and the elbow hurts a lot, you go to the emergency room and they cast it. 2 to 3 days later, the elbow doesn't really hurt anymore. But it's
Mhm.
going to take maybe 2 more months to take the cast off and for you to do rehab exercises to bring it back to strength. So it takes time. The point is that healing takes time. On average, 6 to 12 weeks of healing. So at the beginning, what you may feel, many times you might feel a little more irritation. That's why we ask you to have ice, to rest, to listen to your body, meaning like if you're standing like we are right now and you start to feel, let's say it's your lower back, and you start to feel some discomfort,
Mhm.
then sit down for a little while or lay down for a little while. Or
Yeah,
vice versa. If you're
right.
sitting down and it starts to bother you after 10 minutes, then get up. So listen to your body. Use ice preferably as an anti-inflammatory or anything natural that we might have recommended to you to take away some of the inflammation and numb it a little bit as your body goes through healing.
Mhm.
Now, the contrary could happen. What if you feel good immediately
Yeah,
after?
that could be a problem too, because sometimes, kind of like you said, the analogy with the cast, if you have a cast on your elbow, in 2 days it feels better. We know that the elbow's not healed yet. That bone still has a lot of mending to do, a lot of recuperation to do. But then you start just, living your normal routine, and that can interfere with the healing process. So if you're not feeling 100%, that would keep you down. But if you're feeling great, it's still healing. So you need to be very
Mm-hmm.
careful and not overdo it, and take really good care.
Right? So listen to the specific instructions that your doctor is giving to you. Even if you're feeling great, you have to allow time for the body to heal. So if you're feeling too good and you go do something that you shouldn't have, you're going to cause more damage, more of an injury, and it might extend or prolong how your body will heal. So what to expect is basically you should start to see a change, a gradual change in how you feel, in the intensity of pain and the frequency of it. It should start to decrease gradually as the time goes on. And then by the time we finish with care, it could be 6 weeks, 8 weeks, 10 weeks, maybe even
Mm-hmm.
more, then we'll see how much your body has allowed to progress. For example, here we have an example of what a normal looking vertebrae looks like. This is the bone or the vertebrae. In between that, we have the cushion, the shock absorber, and in the other vertebrae. Behind that, we have space where the nerve comes out. So this is normal. This is a healthy looking one.
Mm-hmm.
Now, this one, as you can see, doesn't look as good. The disc itself has worn out. You have all these protrusion, all these points, which are spurs or calcium deposits. So we call this condition degenerative disc disease or osteoarthritis. Now, this normal, healthy looking one has the capability to heal way, way faster than this one does. So
Mm-hmm.
this will heal faster, this will heal slower. So where are you in between? Are you here or are you there? So if you're here, the expectation will be that your process or your progress will be slowly, but it will go. It will go slowly. You just
Yeah.
have to listen. We have to give you exercises to strengthen it eventually. So you just got to be patient with
Mm-hmm.
yourself to allow your body to truly get to the maximum that your body is capable of doing.
Mm-hmm. The beauty of us taking x-rays and giving you a report on your second visit when you're with us, we can see if you have something like this, because if you have such degeneration, you can expect to heal a little bit slower, and this is just typical. But what we always try to do is find the root cause of your problem and help you be the best to your body's ability. Sometimes it won't be 100% like it was when you were 15 or 20 years old, but wouldn't it be great to get 80% or a high percentage where you can still have a quality of life? If you have grandkids, you like to golf, you like to go in the garden and do all the things you love to do. That's what we want to do. We want to get you back to doing the things you love to do, but it might not happen overnight. And we want you to
Mm-hmm.
understand you have to be patient. It's not going to be like 3 visits. Why aren't I better yet? Well, this took, how many years do you think this took?
15 plus years at
Yeah,
least.
it took at least, 15 plus years. And then there's lifestyle, stress, the chairs you sit in, the activities you do. So many things factor
Mhm.
into it, right?
Sure. And for those of you who might come in and you know that you have a very acute herniation, this herniation could be the cervical spine or the lumbar spine. This is again a model of the spine, and a herniation will look like
Mm-hmm.
this material coming out of its normal content. That has a lot of irritation, a lot of inflammation, a lot of compression to the nerve, and the nerve, think about it, it kind of swells up. That
Mm-hmm.
again cannot go away immediately. It's a very delicate, very critical condition. So you have to be patient. If you can sit and it hurts after 5 minutes, as you progress, that 5 minutes is going to be 10 minutes,
Mm-hmm.
15 minutes, a half an hour. Then you'll say, well, I can sit for an hour now.
Right.
That is a good indication that your body is healing, and you don't want to push beyond its capabilities as it's healing, because if you go beyond that, if you sat 2, 3 hours, you went for a ride to south of Phoenix to Tucson perhaps, and when you get out of the car, you could hardly get out of the car because
Yeah.
2 hours, you were 2 hours of compression. So you should have stopped at 1 hour. So be in communication with us. We
Yeah.
kind of monitor your case to see how you're going, how you're progressing, what you should be doing and not doing. And if in doubt, don't do it.
Yeah.
Listen to your body. Don't say, let me try to see if I can get away with this. Don't do that, because it's going to slow down your progress. And we want to get there as quickly as your body allows. We are on your team. We want you to get there,
Yeah.
but we got to work together.
Yeah. So the whole point of this is to let you know that healing takes time. Some people might feel better the day or a couple of days after treatment, but for most people, it's going to take all the time that we said, and maybe even beyond that. But the good thing to focus on, you're going in the positive, correct direction that surgery couldn't give you, drugs couldn't give you, doing nothing couldn't give you. So just hang in there, be positive, and like Dr. Lara said, our goal is to get you to be the best you can possibly be.
That's right. We hope that this has been informational to you. If you have any questions, please feel free to ask
Mm-hmm.
us and ask your doctor. And we're here to help you to the road of recovery and get there as soon as your body can let us get there.